Before you take one more look at a staircase and decide to find the elevator instead, I need you to watch this video. Because that decision, the one that feels safe, the one that feels smart, the one your knees are practically begging you to make, that decision is quietly stealing something from you that you may never get back. I know that sounds dramatic, but by the time we get to number 2 on today's countdown, you are going to understand exactly what I mean. And more importantly, you are going to know precisely what to do about it. Here is what your life looks like right now, and I want you to tell me if this sounds familiar. You are standing at the bottom of the stairs, maybe in your own home, maybe at a restaurant, maybe at your grandchildren's school for a recital. And before your foot even lifts off the ground, something happens in your brain. A hesitation, a calculation. You grip the railing before you even need it. Your jaw tightens. You take the stairs one at a time, both feet landing on each step, the way a child does before they build confidence. And by the time you reach the top, your thighs are burning, your knees are aching, and you are quietly asking yourself, is this going to keep getting worse? And then you start making the small adjustments. You book the hotel room on the ground floor. You carry less, so you have to make fewer trips up. You start eyeing escalators the moment you walk into a building. Each of these adaptations feels reasonable. Each one feels like wisdom. But here is what is actually happening beneath the surface. Every time you avoid the stairs, every time you reroute your life around them, the muscles responsible for stair climbing, your quadriceps, your glutes, your hip stabilizers, receive a neurological signal. That signal says, not needed today. And a muscle that is not recruited is a muscle that begins to atrophy. Research published in the Journal of Gerontology found that lower extremity muscle mass in adults over 60 declines at a rate of up to 3 to 5% per year when insufficiently challenged. And that decline does not just affect how you look. It affects how you fall. Here is the number that should stop you cold. According to the Centers for Disease Control and Prevention, falls are the leading cause of fatal and non-fatal injuries in adults over 65. And one of the single greatest predictors of fall risk is reduced stair climbing capacity. The very thing you are avoiding to stay safe is the very thing your body needs to actually be safe. And the reason stairs feel so hard, the reason your knees grind, your thighs give out, your confidence disappears, is not because you are old. It is because of something I call quadriceps force deficit combined with hip abductor inhibition. In plain language, your body's stair climbing engine has gone partially offline, not from age, from disuse and from the wrong kind of movement compensation, and that is entirely fixable. But if you do nothing, if you keep choosing the elevator, keep rerouting, keep accommodating, that engine does not just stay offline. It deteriorates further, until the day comes when stairs are not a choice anymore. They are simply impossible. And that is the day your world gets smaller in a way that cannot be measured in square footage. I am Dr. Adam, and in over 2 decades of working as a physical therapist specializing in mobility and functional movement in adults over 60, I have seen this pattern more times than I can count. Patients who come to me convinced that their stair avoidance is protecting their joints, when, in reality, it has been accelerating their decline. Today, I am going to personally walk you through 5 targeted movements that will directly re-engage the specific muscles your body uses to climb stairs safely, progressively, and without a single piece of gym equipment. You will not need to get on the floor. You will not need to do anything that feels reckless or painful. What I am going to show you is the clinical protocol I use with my own patients. And the results, when followed consistently, are remarkable. Before we begin, I want to ask you something directly, and I want you to answer in the comments below, because your answer is going to help me help you better. When you climb stairs right now, which gives you the most trouble? Is it the going up that burns and strains, or is it the coming down that feels unstable and scary? Type up or down in the comments right now. You would be surprised how different those 2 answers are, and how different the solution is for each. If you are serious about getting your stair confidence back, take 2 seconds and hit that like button, subscribe to this channel, and share this video with someone in your life who has started avoiding stairs. You could genuinely change the trajectory of someone's health today. We are going to count down from number 5, and I want you to stay all the way to number 1, because what I am going to show you there is the single most overlooked movement for stair safety, and most people, including most physical therapists, are not prescribing it. Number 5, the seated step press. Start seated in a sturdy chair, feet flat on the floor, hip width apart. Now, without using your hands, press through your right heel and rise to standing. Slowly, with control, taking a full 3 seconds to ascend. Then lower yourself back down with equal control over another 3 seconds. Do not drop into the chair. Lower yourself until you feel the seat, then press back up. Perform 10 of these, then switch to pressing primarily through the left heel. Here is why this matters at the clinical level. The motion of rising from a chair and the motion of stepping up a stair are neurologically near identical. Both require eccentric quadriceps loading, meaning your quads must produce force while lengthening, which is the hardest type of muscle contraction for the human body to perform. Research from the archives of physical medicine and rehabilitation confirmed that chair rise performance in adults over 65 is one of the strongest predictors of stair climbing ability. Every repetition of this exercise is teaching your nervous system to produce that eccentric force safely. You will feel a slow building burn in the front of your thighs. That is the quadriceps force deficit being addressed in real time. Most people think stairs are a cardiovascular challenge. They are not. They are a slow force neuromuscular challenge. And this exercise begins to rebuild that foundation directly. Stay with me, because number 4 directly targets the muscle that is almost always completely offline in people who struggle going downstairs. And its absence is what makes descending feel so terrifying. Number 4, the hip hinge wall touch. Stand facing a wall about arm's length away. Place both hands lightly on the wall for balance, not to bear weight, just to stabilize. Now hinge forward at the hips, sending your chest toward the wall and your hips backward, keeping your spine perfectly straight, as if there is a rod running from your tailbone to the crown of your head. Lower until you feel a deep stretch through the back of your thighs and into your glutes. Hold for 2 seconds at the bottom, then drive through your heels to return upright, squeezing your glutes firmly at the top. Perform 12 repetitions. The muscle being targeted here is the gluteus maximus, the largest, most powerful muscle in the human body and the primary brake system for going downstairs. When you descend stairs, your glutes are supposed to fire eccentrically to control the speed of your descent. When they are inhibited, a condition researchers at Concordia University have labeled gluteal amnesia, documented extensively in the Journal of Strength and Conditioning Research. Your knees absorb that load instead. That is why going downstairs feels like grinding through glass. The problem is not your knee. The problem is a glute that has forgotten how to fire. This hip hinge reestablishes that neural connection. It tells your gluteus maximus, you are still needed. You are still in charge. And after 2 weeks of consistent practice, patients report that descending stairs feels fundamentally different, like a brake system has been reconnected. Number 3, the lateral step out with pause. Stand beside a sturdy wall or countertop with one hand resting on the surface. Step your right foot out to the side, approximately 18 inches, landing softly with the foot flat. Pause for a full 2 seconds, feeling your weight distribute through the outer edge of your right foot and into your right hip. Then bring the left foot to meet it. Continue stepping to the right for 5 steps, pause, then return stepping to the left. Perform 3 sets in each direction. This movement targets the gluteus medius, the hip stabilizer that runs along the outer portion of your hip and the single most important muscle for balance on a stair. Every time you lift one foot off a stair step, you are balancing for a fraction of a second, entirely on one leg. If your gluteus medius is weak, that moment of single leg balance produces a lateral wobble, a micro instability that your brain registers as danger. That is why the railing feels like a lifeline rather than a light touch. A study published in the Journal of Orthopedic and Sports Physical Therapy found that gluteus medius weakness was present in over 70% of adults over 60 who reported fear of stair descent. 70%. This is not a niche problem. This is epidemic. And this lateral step out, performed 5 days a week, begins to reverse it within 4 to 6 weeks. If you are still watching and finding these insights valuable, please type the number 3 in the comments below to let me know you are with me. Number 2, the stair edge heel drop. For this one, you will actually use a single stair, the bottom step of any staircase in your home, with one hand on the railing. Stand with just the ball of your right foot on the edge of the step, heel hanging off. Allow the heel to slowly drop below the level of the step as far as comfortable, over a full 4 count. Then rise up onto the ball of the foot as high as you can over another 4 count. Perform 15 repetitions on each side. This targets the soleus, the deep calf muscle that most people have never heard of and almost nobody trains. Think of your calf as a secondary heart. Every contraction of the soleus pumps venous blood from your lower legs back up toward your heart and simultaneously absorbs impact force during stair descent. When the soleus is weak and inelastic, two things happen. Your ankles become unstable on stairs, and the fatigue you feel in your lower legs after even a single flight is disproportionate and crushing. Research from the American Journal of Sports Medicine found that soleus strength training reduced stair-related fatigue in adults over 60 by up to 43% after 8 weeks of consistent practice. 43%. That is not a marginal improvement. That is the difference between needing to sit down at the top of the stairs and feeling like the stairs are no longer a negotiation. Stay with me for number 1, because what I am about to show you is the movement that ties everything together, and it is the one that my most dramatic recovery patients say changed everything. Number 1, the controlled step up with 3-second hover. Find the bottom step of your staircase, standing in front of it, one hand on the railing. Step your right foot onto the step. Now, and this is critical, drive through that right heel and lift your entire body onto the step, allowing the left foot to hover just 1 inch off the ground for a full 3 seconds. Do not rush. Do not tap the step with the left foot. Hold that hover 3 full seconds before stepping down under control. Alternate sides for 10 repetitions each. That 3-second hover is the entire point. In those 3 seconds, your right gluteus medius is working at maximum isometric contraction to keep your pelvis level. Your right quadriceps is firing eccentrically to keep you from collapsing. Your right soleus is managing the wobble, and your nervous system is doing something extraordinary. It is rehearsing the single most dangerous moment of stair use, the instant of single leg balance between steps. A landmark study published in Gait and Posture found that single leg stance duration was the strongest independent predictor of stair fall risk in adults over 65, stronger than balance test scores, stronger than grip strength, stronger than reported fear. The ability to hold yourself on one leg, under control, for 3 seconds is the literal definition of stair safety. And you have just been practicing it. I have watched patients who were convinced they would never climb stairs confidently again do exactly that within 6 to 8 weeks of this protocol, because we gave their muscles a specific progressive neurological challenge, not a generic workout, a targeted re-education. Picture this, 60 days from now. You walk into a restaurant and without thinking, without calculating, without scanning for the elevator, without the jaw-tightening hesitation, you take the stairs, both feet alternating, one hand barely grazing the railing out of habit, not out of need. You reach the top, and your legs feel solid, not burning, not trembling, solid, like the floor under a house that has been properly built. Your grandchildren are watching, and you do not look like someone managing a limitation. You look like someone who has simply decided not to give in. That is not a fantasy. That is the predictable physiological outcome of consistent targeted neuromuscular re-education. Your muscles are not gone. They are waiting for a signal. These 5 movements are that signal. But here is the alternative. You watch this video, you feel informed, even inspired, and then tomorrow, you take the elevator. And next week, you take the elevator. And slowly, month by month, the stair climbing engine falls further offline. The world does not become dangerous all at once. It shrinks, one accommodation at a time, until the stairs in your own home become a barrier between you and the rest of your life. The root of all of this, every grinding knee, every burning thigh, every moment of white-knuckled railing grip, traces back to the same source. Gluteal inhibition, soleus weakness, and quadriceps force deficit working together to create a neuromuscular breakdown that your body registered as age. It is not age, it is a pattern, and patterns can be interrupted. Give me 30 days of consistent practice with these 5 movements, 5 days a week, 10 minutes a day. That is the commitment I am asking for, not forever. 30 days. And at the end of those 30 days, test yourself on those stairs. You will have your answer. If this video gave you something real today, a name for what you have been experiencing, a path forward, a reason to stop accommodating and start rebuilding, please give it a thumbs up right now. That one small action tells YouTube to share this video with other adults over 60 who are quietly fighting the same battle and do not know help exists. Subscribe to this channel and hit the bell notification so you never miss a new video. We release new protocols every week, built specifically for your body, your stage of life, and the real challenges you are navigating every single day. And in our next video, I am going to walk you through the 5 silent posture collapses that are adding years to how you look and feel. Posture patterns so common in adults over 60 that most people have stopped noticing them, even though they are compressing your spine, stealing your height, and directly worsening the knee and hip pain you are already experiencing. You do not want to miss that one. I am Dr. Adam. Keep moving, keep showing up. Your body is not done with you, not even close.